PEPFAR. Saving lives. Investing in people. PEPFAR. Partnering for an AIDS-free generation.
Ingenuity and innovation is key to sustaining the response to HIV/AIDS. PEPFAR and the South African government partner to find innovative ways to manage the epidemic.
When we first started treatment, people were being brought in wheelbarrows, carried, and they were really, really sick and dying. And the treatment just transformed that, and that's through the PEPFAR funding. So two big challenges that face us is how do we reduce infection in young women? How do we integrate HIV/TB services?
So one of the things that we have taken to heart in trying to understand the HIV epidemic is to understand the dual challenges of providing treatment and prevention. We've been able to do that very successfully with PEPFAR, to the point where South Africa now has the largest AIDS treatment program in the world, treating at present in excess of 2.5 million people on antiretrovirals.
We see by age 16, 1 in 10 women is already infected with HIV. By age 20, that is 1 in 3. By age 24, that's 1 in 2. We cannot treat our way out of this epidemic.
Caprisa came up with a revolutionary solution to break the chain in transmission in adolescent women called tenofovir gel, a game changer in transferring control to women in prevention of infection. It was deemed by New York Times a promising preventive.
The Caprisa 004 results really was a paradigm-shifting moment, both in terms of HIV prevention and also in terms of prevention of infection in women.
As the HIV epidemic was advancing and maturing, there was an increase in the number of tuberculosis patients. The Ministry of Health launched a solution for early detection of TB, the Gene Expert Machine. Right to Care was the USAID and PEPFAR partner that managed the rollout.
We're the first country in the world to switch from the old Koch smear, the S/FAS bacilli, to Gene Expert, and that transition is complete. And so every South African now has access to Gene Expert diagnosis, which has led to better, improved, more rapid diagnosis and early recognition of drug resistance.
If you initiate antiretroviral treatment early during tuberculosis, we can reduce the death rate by 56%. If we just implemented our findings in South Africa alone, we would avert about 10,000 deaths a year. That's the kind of impact this research has made.
We actually provided the Department of Health with the strategic plan for HIV treatment going forward. That changed the treatment guidelines and accessed ever-increasing amounts of funding that will eventually target about 4.2 million patients on treatment.
The next innovation to strengthen the healthcare system not only challenged waiting times, but also allowed pharmacists time to interact with patients.
Our pharmacy automation plan has really crystallized out through the initiative of a number of individuals. I had challenged the team to say that the waiting times in the clinic all surround the pharmacy.
When I first started working here, we used to see about 800 patients a day. Those patients would queue from as early as 3 a.m. And I mean, by 8 o'clock, I'll still be down there trying to finish those patients, and it was not possible. Some would have to go home without that medication, unfortunately. But once the machine was installed, then things were even way better. The machine actually brought a whole new dynamics to pharmacy.
It also has reduced the cost of prescription. We actually have a cost reduction to about half the amount of money per script dispensed. And we've eliminated stock losses and expiring medication. So now the script is in the cloud. The patient can go anywhere within our network and they can receive a script based on a chip card and draw down their medicine dispensing. So these are very exciting developments, bit novel, bit new, certainly innovative.
If PEPFAR didn't give me this funding that I have, I wouldn't be able to actually have the impact that I have in patients' lives.
An AIDS-free generation is achievable, but it's not achievable soon. It is something we have to look to as a long-term goal. We have many approaches and many technologies that we can use to take us down the path of steadily diminishing the impact of HIV.
PEPFAR, partnering for an AIDS-free generation.